Hello, good morning. My name is Bianca Vega. I am located in the Galen College of Nursing in San Antonio, Texas. And today my topic is going to be on donating blood. Donating blood was something I did not think about much until I reached sophomore year in high school. I will see recruits in a booth in my cafeteria, and they would be signing up students to donate blood, and I will donate blood along with my friends, only to get out of class and spend some time, until when I was donating blood, then I realized the importance of how much donating blood makes an impact on someone's life. And so ever since I found out the importance, I would sign up once a year to donate blood. And when I realized the importance of donating blood, I also realized that it has affected my personal life. It affected someone who I truly love, and how much they benefited from the blood donations. According to the American Red Cross, blood donors help patients of all ages, accident and burn victims, heart surgery and organ transplant patients, and those battling cancer. As I said before, donating blood has affected my personal life. My mother, who I will speak on about later on in this presentation, she was battling cancer, and with her treatment, she was required to receive blood transfusions pretty frequently due to her white blood cell count being very low. And I will speak more about that later on in the presentation. The process of donating blood, the whole process takes about an hour, but when you're actually doing the donation part, it usually takes about 8 to 10 minutes. The whole reason why it takes about an hour is because of the refreshment and recovery space. So when you first want to donate blood, you register. You have to be of age, and then they require to look through your health history to make sure you don't have any diseases or anything that can impact the blood and affect it and harm the person that's receiving the blood donation. And then the third part of the process is that you actually do your donation. You're there sitting in a chair, they get you settled, and then they take your blood, and then after they take your blood, then you recover. And it's important, the recovery process, because you can faint, there can be complications, there can be major problems in the area where they took the blood from. But all this is for your safety, and it is a very easy process. And if you can look into donating blood, I suggest that you do, because it's very important. In 2021, there is a shortage in San Antonio, according to the San Antonio Metropolitan Health District, that has declared a blood shortage emergency. Blood banks were left with a deficit of 2,800 donations. It affects patients who suffer from trauma, accidents, or patients who need blood. And I wanted to further express on this is that patients who suffer trauma, it could be from accidents, such as car accidents, it could be from work accidents, people who lose a lot of blood, and in order for them to recover fully, they need blood to help them. What caused the shortage? In San Antonio in 2021, in the beginning of the year, we had a freeze, and it was really impactful. It left many with no light and no water. It left us for a couple days and maybe up to a few weeks for some. People have died. And with the freeze, what it did, there's an example. There was an accident, a pilot. It left 12 people dead and many injured and trauma. And it was said that they didn't have enough blood donations in order to reach out all the people who suffered from those traumas due to that accident. Another cause of this shortage is, as we all know, because the whole world is in the pandemic, it was the COVID-19 virus. Donating blood can be very important, especially at this time, due to people who have recovered from the COVID-19 virus. They build up antibodies, and what those antibodies do, they can introduce those to other people who, create immunizations and stuff to help others adapt and create those antibodies without having to fully contract the virus. Who does it help? Cancer patients, trauma patients, sickle cell patients, burn patients, patients with chronic diseases. And donating blood is a gift of life, which is why I inputted this image here. And I would speak more about that. There are different types of blood donations. Whole blood donations. They use the full blood composition, since it is built from plasma, white blood cells, platelets, and red blood cells. Whole blood is the whole blood composition, and they use it, or it can be separated into the different sections of the blood to help multiple people. Automated red cells is a blood donation solely on the red blood cells, and the red blood cells, they're used for trauma patients, patients with anemia, and surgery patients. The third type is platelet, and the cell fragments of platelets are made in the bone marrow, which helps transplants and cancer patients. Plasma helps burn victims and bleeding disorders. In this section, I will be telling you, this is my mother. She is very important to me. She was 43 when she passed away from brain cancer. For 10 years, she was battling 3 different types of cancers. At first, it began with breast cancer. Then she went into remission for a couple months. Then the breast cancer came back. The breast cancer metastasized into both of her lungs. And for the rest of the years until 2019, the lung cancer spread to her brain. And in 3 months, she was taken away from us, pretty young. But donating blood has impacted my mother's life so much, because we would have chemotherapy appointments to go to, radiation appointments to go to, and it was every other day for 10 years. Her red blood cell count and white blood cell count would be very low due to the treatment she was receiving. So she would receive 2 bags of blood every other day in order to help improve her chance of beating cancer, or just being able to live another day, not being in the hospital or on her deathbed. Blood donations have impacted my mom, and they gave her another day to live. And we are blessed that she was able to receive those donations. Due to the shortage right now, many others are not as lucky to receive those donations, and they can be helping saving lives. For example, Amy Murkowski, she's a 3-year-old girl who was diagnosed with acute lymphoblastic leukemia. She had been impacted severely by the blood shortage. Although her treatment has not been delayed, Amy has struggled to receive blood transfusions that she needs frequently. And as my mother, her white blood cell count is low. In order to fight off infections, you need white blood cells. And since there is a blood shortage, it's very hard to help Amy receive those white blood cells that she needs in order to be able to fight off this disease, this cancer. Because chemotherapy does destroy not only the red blood cells or the good blood cells, it destroys everything in the body. And in order to fight off this cancerous disease, blood is a huge help. But due to the shortage, Amy Markowski is having a difficult time. If you can donate today or are interested in saving a life, there are many ways you can donate. There are blood mobiles, clinics, blood drives, and even hospitals. Certain hospitals here in San Antonio allow you to donate blood. I suggest that you donate blood. It is very important to save someone's life. It can affect many people. It can affect their loved ones, just like it affected my mother and me. She was able to live another day, and I would love for Amy Markowski to be able to fight off this leukemia and many others out there who really need this. Because you never know if an accident can happen in a split second, and someone you love can lose so much blood, and then they survive due to the blood donors and the blood donations, the blood transfusions that they receive. It would really help. Thank you.